everyone, I'm News 4's Kay Ingram, and joining us today for our live Q&A about the coronavirus is NBC News medical correspondent Dr. John Torres. Dr. John, thanks for joining us.
You bet. Thank you for having me here.
No, of course, anytime. And so, if you're familiar, all this week we've been doing this Q&A around 2 o'clock for you all because we've been getting hundreds of questions. And today we have the doctor here to answer a few of those. So first up, diving right into it, can you get the coronavirus and the flu in the same season?
That's a great question. Like you said, I've been getting tons of questions too, whether it's on TV or on the street or just even families calling constantly asking questions.
Yeah, you've had a busy week.
But the answer to that question is yes, you can. And the reason is because those are two different and distinct viruses. The coronavirus is actually that. It's a corona-type virus. It's one of 7 that infect humans. 4 of them don't do anything other than give us cold-like symptoms. One of them is, the 5th one is SARS, the 6th one is MERS, which is Middle Eastern Respiratory Syndrome, and then the 7th one is this one that gives us this thing called COVID-19. And so that's different than influenza, which is a different type of virus. So you could get influenza, get recovered from that, and then get the coronavirus. The big difference between the two being we have a vaccine for the influenza, they're developing a vaccine for coronavirus. And so for people that are extremely worried, I tell them all the time, get that flu vaccine because that'll prevent you from getting sick from the flu, which you might confuse for coronavirus.
Now, Dr. Torres, you said something interesting about we're in the process of developing that vaccine. Where are we at with that?
So actually they're doing a very good job, and they're getting a lot of heat from people saying, why don't we have a vaccine? Typically vaccines take 5 to 20 years to develop because part of it's the developing the vaccine, part of it is making sure it's safe with trial after trial, because the last thing you want to do is one of two things that could happen. Either it doesn't work very well and you're giving it to people and it doesn't seem to work very well and it could cause side effects because of that, or it actually could put your immune system in a position where it actually makes it more likely to catch coronavirus or have side effects because of coronavirus. So that's why they need to do it. So this thing we've essentially known about since the beginning of the year. Within a few weeks, they were able to get the genome, the genetic background of this virus, and develop the vaccine. And now what they're going to do is they're testing it in humans. They're going to start soon. They think within 3 months they'll have those tests accomplished, and then they need to do bigger tests because the first test is just to see if it's safe. Then the bigger test is to see if it works. And once they do that, then they need to produce it, and that takes time. And so we're talking, according to the National Institute of Health, 12 to 18 months to get the vaccine, and that is extremely fast for vaccines.
Wow, 12 to 18 months.
Right. I know most people want it right now, but we want to make sure we have a safe vaccine that works. The worst thing to do is put a vaccine in that later on we find out is causing more problems than is doing good.
Awesome. So a safe vaccine that works. Guys, if you are just now tuning in, you're watching our live Q&A. Here in studio with us, we have Dr. John Torres. He's NBC News medical correspondent. And as you're watching this, maybe you have a question or two. Be sure to comment below. We'll try to get to some of those as well. So next up, someone wanted to know, how do you actually treat the coronavirus and someone who already has it? We've been seeing every day, it seems like something new's popping up with a case.
Right, and right now, the only way to treat coronavirus, there's no medicine that specifically helps coronavirus. If you think about the flu, there's 4 approved medicines that can treat the flu, and those do a fairly good job of one, making sure it doesn't last very long, but also reducing hospitalizations, reducing deaths from the flu. We don't have that with coronavirus. There's no medicine. There is one they're starting to do clinical trials on in South Korea and in China, but we haven't gotten to the point where that's approved for use. We don't even know if it's going to work actually. So right now with coronavirus, the best thing to do is what we call supportive care. And that means doing the things they need to do. And if you read about it online, there was a gentleman that tweeted out about the fact that he had coronavirus and pretty much he drank Gatorade for 5 or 6 days straight, just trying to keep hydrated. So it's keeping hydrated, keeping as much nutrition as you can, lots of rest, and if you have respiratory issues, because this is a respiratory virus, possibly putting them on a ventilator. And what that does is that allows their body to heal and get rid of that virus. People that have underlying medical conditions might end up getting sicker and sicker, and those are unfortunately the ones that have died because of this. But there's no medicine right now.
No medicine right now. We did just talk about the process with the vaccine, at least in the meantime. Right. So again, I mentioned wherever you're watching this, be it YouTube or Facebook, to comment below. And we've already got our first comment. Jesse here on the side says, Savannah from YouTube wants to know, how did the outbreak start?
So it started in this town called Wuhan, China, which is in the Hubei province, which is essentially, think of it like a big county in China, or maybe even a state in China. It's that large of an area that's very, very populated, tens of millions of people. In the town of Wuhan, which is a very populated town as well, there's what's called a wet market in that town. That wet market usually has live fish and other exotic animals that they have there. The exotic animals they'll use for their meat, and people eat that meat and they think that's the meat got infected with this coronavirus, which they get coronaviruses all the time, but they rarely ever go from animals to humans. They think what happened is this one mutated so it can move from animals to humans, which is okay to a certain point because we can keep people away from animals and we can keep it contained. But then the next step is once it goes from human to human, it becomes kind of like the flu virus, where it's really hard to contain because it's going through the air and getting to people that way. So once it did that, which was at the end of December, early January, that's when it started turning into this outbreak and affecting thousands and thousands of people. And so again, it started in animals. It's probably been in animals for decades, but it mutated, changed just enough to get into people, and then it changed just enough more to go people to people. And that's when it starts becoming a problem, and that's what happened here, they think. They still haven't gotten down, and I don't think they ever will get patient zero, because by the time everybody found out about it, there were so many people that had it, but they suspect that market in Wuhan, China.
And for those who aren't familiar, patient zero, that being the
patient zero is the one they can,
start.
patient zero, if you ever saw the movie Contagion, that's the one they go back and they say, that's the first one that did it.
Yeah.
That's when it started. If they can find patient zero, that helps them determine where it came from, and it helps them determine how to fight it. But if they can't find patient zero, it makes the hunt a little bit tougher. And in this case, I don't think they're going to be able to find it because so many people had it initially.
Well, we'll just have to keep looking. Savannah from YouTube, thank you so much for that question. All right, next up, cleaning protocols. Dr. Torres, I know you have some things here for us to break down some steps, right? How long can this virus survive on surfaces, and what can we do to make sure that they don't?
So the virus is so new, we don't know a lot about it, but coronaviruses in general, and this is a coronavirus, and we think this one matches that, depending on what it is. If it's metal, as in railings or desks or anything that are metal or glass, we think it lasts 5 to 10 minutes in that area. But other products, especially if it's gotten into cardboard, it's gotten into clothes, things like that, we're not sure it's possible it could last hours in that arena. And so the one thing you want to make sure is that you keep yourself as clean as possible and keep yourself as disinfected as possible. That means a couple of things. For us, if we're out and about, the best thing you can do is wash your hands. Soap and water, 20 seconds. For people that don't know what 20 seconds is, because I'm not very good at timing it, sometimes I time out at 10, sometimes I time out at 30. Sing
it all along.
Sing happy birthday twice, and that'll get you to 20 seconds. That's by far the best way to do it. If you can't get to a sink, the next step is the alcohol-based hand sanitizers, those gel hand sanitizers. You want to make sure it's 60% alcohol. And I've gotten a lot of questions from people saying, well, I saw on the web about these DIY, these do-it-yourself hand sanitizers. I advise against that. Mainly because it's hard to do. Number one, you're probably going to do it to where it's a harsher chemical, so it's going to cause more problems with your hands. You can get cracked skin. If you get cracked skin, the virus can get in a lot easier. So you want to be careful of that. Number two, it might not be effective because today a tequila manufacturer actually came out and said, don't use our tequila because their tequila isn't strong enough alcohol in order to get that 60% level. And so more than likely you're going to make it wrong and it's not going to be effective. Question I get from people all the time is, well, what if I can't find hand sanitizer because there seems to be a run on it right now? Wash your hands. Soap and water, it's the best thing you can do. So that's you yourself. If you're out and about, disinfecting wipes can certainly help, especially if you're at a restaurant or someplace where you want to disinfect the area. The main thing you want to make sure is that it's one that is basically CDC approved. The CDC has come out with a few different lists on what to approve, and you can go to cdc.gov and find those. But they also say that regular household cleaners, but if you look here, and I have my little prop here, so this is just one. There's lots of different types, and I'm not saying this one's any better than the other ones, but if you notice here, you look on the back, what do you see there?
Human coronavirus.
So this one's approved for human coronavirus, right? And so just look on the back and see what it can actually kill. If it kills most viruses, then you're probably good to go with that wipe. The main thing with the wipes you have to remember, because people do this all the time, where they'll wipe it and they'll clean it off with a paper towel, let it air dry. Usually around 4 minutes, which is what you need.
Wow. Did y'all see that? Literally on the back. I have never noticed that it says human coronavirus on the back of a Lysol.
It's been saying that, I think, since SARS came out. So
I am just learning so much today. Thank you so much. All right, it looks like we have another question. We have Noemi from YouTube. Can I get COVID-19 from someone sitting on
sick on
public transport? Thank you, Dr. Torres. Sick on public transportation. Can you get sick?
Potentially you can. The main thing is, so this is a respiratory virus, and so you can get it from close contact. What they consider close contact is if you're within 6 feet of somebody who is coughing or sneezing, because the way you get it is two different ways. One is somebody coughs on a surface, you touch it, then you touch your nose, your mouth, or your eyes, and you get it in. That's the way it gets into your body. The other way, the way that most likely happens, is people cough or sneeze, and you're close enough to them for a long enough period of time that those particulates that they cough out. So if you see people cough and sneeze, all this gross stuff comes out.
Yeah.
Some of those get into the air and they can float around for a few minutes, and they can get into your lungs. If that happens, then you can get coronavirus. So theoretically, on a public transport, that could happen. What I'm telling people now is, whether you're at a theater, whether you're at a concert, whether you're at a restaurant or on a public transportation, up until now, most of us are very polite and very embarrassed to tell somebody something. So if you see somebody coughing or sneezing, I think now is a good time to tell them, hey, do you mind covering up real quick? Just cover up when you cough or sneeze. If for some reason you don't want to do that, or for some reason they don't want to do that, simplest thing is just move. Move to another car. Get off the bus. Ask the restaurant if you can move to another table. I think now is an okay time to do that and say, I don't want to be sitting next to that person that's doing that. Protect myself as best I can.
You hear that, New Yorkers? We have permission, okay? Let someone know.
Doctor's orders.
Right? Sneeze into your elbow, all that good stuff.
Right.
All right, we've got another question. It comes from Angie on Facebook, and Angie wants to know, what is the incubation period for something like this?
So first off, the definition of incubation period, that means from the time the virus gets into your body until you start showing symptoms. And the symptoms for this one are usually fevers and cough are the initial ones. Then you start getting higher fevers, muscle aches, and respiratory problems. Sometimes people can get GI issues or throwing up, that type of thing. The incubation period, again, means that from the time the virus gets in your body until you actually get to the point where you start showing those symptoms. For this virus, it's about 14 days is the maximum, and that's why you're hearing about all the 14-day incubation periods that are going on, because they're saying if you got this at day 1, we want to watch you till day 14 to make sure you don't develop the virus. You don't develop the sickness, the disease from the virus, the COVID-19, and we want to test you along the way. 14 days is maximum. Usually around 3 to 5 days is when you'll first start noticing symptoms, but it could be up to 14 days later.
Got it. So incubation, self-quarantine.
Right, and if people, and basically the difference, there's two things, self-quarantine and isolation. Self-quarantine means that you were in an area where you possibly were near somebody who had it, and they just need to keep an eye on you, but you're not showing any symptoms. And that means staying home, not going out, and checking yourself for symptoms. If you develop symptoms, then you start getting the disease, then you go into isolation. Isolation is when they put you in the hospital and you're protected from being around anybody else. Healthcare workers come in, they're fully garbed up with gloves and masks and everything. That's the difference. So quarantine is at home where you're not showing any symptoms yet, you don't have the disease, and are checking to see if you get it. Once you get the disease, you go into isolation.
And to be sure, you're checking to see if you got it, because maybe you travel to,
if you travel to an area that was affected, they might say, we want you, if you came from Wuhan, China, they're going to say, we want you to self-quarantine for 14 days, which is what's happening on all these cruise ships. They're saying somebody was on it, somebody had it, let's make sure that nobody else is spreading it around, so everybody has to stay on for 14 days.
Nice. And of course, we've been following, those stories for the past few days, weeks.
Oh, yeah.
So next up, of course, summer is coming up. We have this change in the weather, warmer days are ahead, and with that are like barbecues, right? So people are making food, and one of the questions we got is, should we be worried about food prepared by others? And in addition to that, of course, packages from overseas and anything that's, in maybe one of those affected areas.
So the two questions, one is packages from overseas. The CDC has addressed that, and they said you don't have to worry about that because it's extremely low risk. Anything can happen, mainly because of that, what we talked about, how long can it last on a surface?
Right.
And it can't last long enough for it to ship all the way over here from the areas that are affected. So not something you really have to worry about. Somebody preparing your food, on the other hand, that's a little bit different, and there's a lot of things you have to worry about, including other viruses and other foodborne diseases. This potentially could be one of them if they're sick with this type of illness, if they're sick with COVID-19 and they're coughing all over the packaging, and then you get it open up right away within an hour or so, you could possibly get it too. I wouldn't worry so much about the food as I would about the packaging around the food being contaminated. And so the best advice is make sure it's a trusted area that you're at, and protect yourself as best you can.
Nice. Again, another reminder for you all, you're watching our live Q&A on the coronavirus, and here we have Dr. John Torres, NBC medical correspondent here at 30 Rock, and we've been answering a lot of your questions, some of which are coming live from wherever you're watching, be it YouTube or Facebook. Keep those coming, because I think you're doing a great job.
Oh, thank you.
I've like already learned so much. If you missed the fun fact about the Lysol, the Lysol pack,
right.
If you have one on you right now, turn it around. You'll see, right? Listed here, human coronavirus, because I just learned there are a few of them.
Right.
Right?
Exactly.
Nice. So next up, should you self-quarantine right now if you have the symptoms of a cold?
No, unless you've been exposed to somebody who has and has been diagnosed with COVID-19, the disease. And so if they've been diagnosed and you're near them or close to them and you're starting to show symptoms, then you need to call your healthcare provider. You need to call the emergency room or somebody, because it might be they want to put you in isolation. They definitely probably want to test you to see that you don't have it. But the main thing is to call before you go anywhere, because they want to, just like during the, I don't know if you remember the swine flu epidemic, we said the exact same thing. Call before you go in, because they're going to want to put a mask on you so you're not infecting everybody else in the area. More than likely, and again, there's a few hundred cases here in the U.S., so more than likely if you're getting cold symptoms or flu-like symptoms, you probably have a cold or the flu. You probably don't have coronavirus. But if you've been exposed to somebody who does have coronavirus, that puts your risk higher.
Interesting. Yeah, I'm really glad for whoever submitted that question, because I've been hearing a lot of just my friends or colleagues. You know, I have a roommate that she's not doing too well, or you know, she seems to have like a cold, and it's like, oh, should I be worried?
We're still in flu season. We're still in cold season. So more than likely, it's a cold or flu. So again, it's looking at, you know, what are you more likely to catch. So.
Nice. So, Dr. Torres, you mentioned, you know, people are trying to make these DIY hand sanitizers, and that's because a lot of them are selling out, right? We're seeing a lot of the shelves cleared out for a lot of things, including surgical masks and gloves and face masks. So people on Facebook right now are asking, a lot of you want to know, should we wear surgical masks or gloves?
No, the answer is no, you should not. And here's the main reason. The surgical masks, if you look at them, there's two different kinds. There's a rectangular kind. Those are the surgeon's masks. Those are made so the surgeon or whoever's in the operating room doesn't get anything on the patient. So they're made to make sure nothing comes out of the body onto the patient. They're not made to make sure viruses don't get back inside. And they're not very good.
Other way.
They're not very good at keeping a virus from you. If somebody's coughing or sneezing, it's a good barrier to make sure that those particulates we talk about aren't getting across the room. But to protect you, it's not going to do a lot of good protecting you. On top of that, healthcare workers do need it because they're using it for what we talked about, making sure patients don't get infected. The other mask is called an N95, and that's the cup-shaped mask we talk about. That one also the no on, because the N95 has to be specially fitted. When we're in a hospital, we get it fitted, and they do a special test to make sure it's fitted, and they're constantly checking them over the months as we're using them. They're also sized. There's different sizes for different people. And so if you're not wearing it right, and I was at the airport this last weekend, and somebody had an N95 mask on, and they had it down here. So it wasn't even covering their nose.
Not even
and so
wearing it
is not going to help them at all. And the government is saying, the CDC is saying, please, we need to save those for healthcare workers, because they definitely need those to protect themselves from the people they're treating, because we know those people have COVID-19 and they need to be protected. But again, fitted. So no, as far as gloves, you know, if you're talking regular gloves that you use just every day, in cold weather, the big issue there is you can't clean those gloves off. And so if those gloves get dirty, I'm as guilty as anybody. I'm the kind of person that the way I take my glove off is I bite the finger and pull it off. So I'm getting that virus right in my mouth. And so I know, don't want to do that. And you can't clean the gloves, so every time you put them on, you're going to get more virus on your hand. You're going to need to clean your hands, and so it's not going to help a whole lot. As far as surgical gloves, you don't really need those either, because, again, the best thing you can do is just wash your hands before you touch your face.
Why are people like turning to these face masks? Because something interesting, you know, I was talking to someone the other day, and they were saying that a lot of people are wearing these masks to keep themselves from touching their face, but just like with the glove thing, when you're putting it on and off and, and that's touching your face anyway, right?
And I think they look at the overall people walking around with masks. And if you see, especially from China and Japan and South Korea, you see a lot of people wearing masks. Traditionally, they wear those masks because they're trying to keep anybody else from getting what they have. They're sick and they're being polite to other people. Now they're wearing them, plus also because they have an outbreak in the area. Here in the U.S., we don't have that, but you're right. People put them on, and you're constantly putting them on, and you're adjusting them. They fall down. If you've ever used an N95 mask, I don't know if you ever have, they get very hot. After about 30 minutes, you don't want to have that thing on. And so you're constantly fiddling with it, and again, you're getting everything in your face, which is the one thing you don't want to touch.
No, don't want to touch your face. Make sure you're cleaning up, right? We're talking about Lysol wipes and all that good stuff. Now, we have another question from Sunflower Mama. Hey, Sunflower Mama on Facebook.
I love that name.
Right, me too. I'm like, it's suddenly the room in here feels brighter. So Sunflower Mama wants to know, are toddlers and babies at risk? We actually had a pediatrician in yesterday, and she was breaking that down for us, if any of you all are watching yesterday as well. So for those who are just now tuning in, maybe didn't catch yesterday's, are babies at risk?
So it seems to be not an issue with them, and they seem to have some protection. The studies they've done in China, which is where it's hit the most, tens of thousands of people have gotten coronavirus in China. Of those tens of thousands of people that got coronavirus, less than 3% of them are children. Of the children who've gotten coronavirus, again, remember it's less than 3%,
Right.
over 98% of those had just had mild symptoms. And so the vast majority of children, number one, they're not most likely not going to get it. Number two, if they get it, very, very likely it's just going to be a cold-like symptoms. What we think is happening is a couple things. One is we think that they just have rapid immune systems that can adapt very quickly to these things. And so the coronavirus comes along, our immune systems are a little slower, we don't adapt as well, so it can get in our body and take hold. For them, they can kick it out of their body real quick. Plus, children tend to get these colds all the time, and those colds, some of those are coronaviruses, not the same strain, but getting coronaviruses we think gives them some protection against this strain, and that's why they're not getting it as much or as bad.
Interesting.
Yeah.
I'm learning so much. I have to be real. For y'all watching, this is this is a teaching moment for me too. I'm like, there's just so much, and keep those questions coming, please. I'm enjoying this. I love seeing what you all want to know as we talk to Dr. Torres, and it looks like we've got another one. So a lot of you guys are asking, is it safe to travel right now?
This
is it safe?
This is probably the biggest question I get, because people want to travel and they're afraid to go anywhere. And I can't blame them, because all you're hearing in the media is all the different things that are going on around the country.
Right.
And it depends whether you're talking domestic or international. Domestically, the CDC, and I agree with them, is saying there's no issues with travel domestically. Just do the things you normally do to keep yourself protected this time of the year, especially now with the coronavirus out there. And just, keep your hands clean, don't touch your face, cover up when you cough and sneeze, all those types of things. If you're traveling international, it's a little bit of a different story, because there's some countries the CDC and the State Department has put some level threats at, saying, hey, this is a place that has a lot of coronavirus. You might want to think twice about going there. We're talking China, South Korea, Japan, Italy, Iran, those kind of areas where there's outbreaks. Your best bet is, if you're going to travel internationally, go ahead and look at the State Department or the CDC, and they'll give you warnings on what's going on. And some of them say no travel, some of them say only essential travel. Some of them say go ahead and travel, but make sure you increase your vigilance and your hygiene while you're out there. And so just look there. If you happen to be in a country and you're worried about that country because you're already there, call the embassy, and the embassy can help you there as well.
And advise you on.
Advise you. Do you need to? Can you stay? Do you need to leave? If you need to leave, do we need to evacuate you? All that information.
Interesting. It sounds like a lot of it's up to you too, right?
It is.
Whether or not you want to risk.
A lot of it's up to you.
going along.
And what I talk about all the time is, right now we're getting a lot of information. That information is making people very anxious. But people do need to go on with their lives, and they need to do the things they're doing. I'm hearing a lot of people canceling vacations, and I understand why they're doing that. But at the same time, it's one of those things that a lot of them should go on these vacations, because it's something that's going to let them take that deep breath and just say, okay, we're okay with this.
I like that, right? It's a moment to get out of this anxiety of stress of what's going on.
But it's hard not to be stressed because of all the news we're hearing about it. So
I am right there with you. But thank you so much, Dr. Torres, for being here, and for you all for joining and commenting all of your questions. We really appreciate it. And yeah, we'll continue to bring you developing coverage and live updates on our website, in the app, on social media. And yeah, if you don't have our app, make sure to download that right now, because that's where you'll get those up-to-the-minute updates really quick to your phone. So thank you again for being here.
You bet. Thanks for having me.
Thank you all for watching.